All right. We're starting to record, Gina. Thank you.
Yeah. Hi, Jamie. How are you?
Awesome. Thanks for agreeing for this interview.
Sure. I'm excited for it. Excited to share my insights into nursing.
Absolutely. Do you want to share your screen right away, or do you want me to like the partway through, or what's the best?
Um, you go ahead and ask me questions, and then I'll share it as I see fit as we move forward.
Perfect. I love it. Okay. So first question, I wanted to ask for students, prospective students who want to get into the nursing program is when and how often can students apply to get into the nursing program?
That's a great question. So, students can apply twice a year. They can apply in the fall for spring and in the spring for fall. So applications for fall start are due the third week of April. And then applications for, I'm sorry, the fourth week of April. And then applications for a spring start are due in September on the third week of September, the Monday of the third week of September. So there's two application cycles that we follow, and we admit 48 students in each of those application cycles.
Okay, 48 students. And do they have to have all their prereqs done when they apply for the program, or can they be in the middle of finishing one?
That's a great question too. So they can be in the middle, and many students in the fall, when they are applying in the fall for the spring, are in the middle of completing their prerequisites. And the only drawback is there are points for having everything complete before you apply. But many students in that fall application for the spring are not complete, and it's not a deterrent for them. In the spring, for the fall application, most students are ready to go. They are completing it, but the application is not graded or calculated until after the spring semester is finished. So even if you're taking classes in the spring, they will be completed and you'll be graduation ready.
Oh, okay. Okay.
That makes sense.
Uh-huh. Uh-huh. And you said you have 48 students that get in each cycle. How
Correct.
many students apply?
So it varies. The last two application cycles we've had a little bit under 100. I have seen as high as 150, but that has dwindled over the last 4 years, and I think that's because there's different programs out there available for students.
Gotcha. Gotcha. What are the requirements for students to be able to apply to get into the nursing program? What do they have to make sure that they have completed?
So let me pull my screen up. So I'm just going to share our nursing eligibility and prerequisites. So the eligibility guidelines are to complete all of your general education requirements before starting the nursing program. You also have to have 60 credits completed by the time you enter the program.
Okay.
Okay. So the same requirements as you would have if you were applying for an associate's degree.
Mhm.
The prerequisite courses that you must complete are human biology, but they will take Bio 1010 or Bio 1610, human anatomy, human physiology, chemistry 1150 or 1110, either or higher if they've taken a higher one. A math GE class, so it does not have to be statistics. That is preferred if you are going to go on from school into like a master's program or a nurse practitioner program. They would want statistics, but we'll take any GE math. So it can be math 1040, 1030, 1050, whichever one applies to you. Human development, which is FSHD 1500 or Psych 1100, either or, not both. Scientific Foundations of Nutrition, which is FSHD 1020. And then they can either take Nursing 3900 or Biology 4400. And then they must take English 1010 and English 2010 or English 2100 to fulfill their English requirements. If they're an English second language student, they must complete medical terminology before applying to the program. And then all of these courses must be completed with a C or higher, and their minimum GPA in their prerequisite classes must be 3.0, but that's minimum. So 3.0 gets the least amount of points, a 4.0 gets the most amount of points. It's not very often that a 3.0 student gets into the nursing program. There are exceptions. Every once in a while, we'll have a 3.0 or a 3.1 student that gets in, but most typically, your GPA for those prerequisite courses must be higher than a 3.0 to get in. Okay.
Do you recall from the last couple of cycles what the lowest grade point was that got in?
I don't. I know that there was she graduated this last, there was two in one that graduated this last spring. One was a 3.1 and one was a 3.0, but they completed and maxed out all of their other requirements. So that kind of offset that 3.0 status that they had.
More often than not, is it more like a 3.7 that gets in, something higher?
Typically, but that changes every application cycle. But over the last 4 years, about the average, every application cycle has been a 3.7.
Okay, excellent.
And that's average. So there's a little bit below and a little bit above that. So, we just never know. I've also had times when students that are 4.0 haven't gotten in because their HESI was low. And we'll just probably talk about the HESI in a bit.
Okay, excellent. Super helpful. Let's see. Okay, you've said that. We've got the what's the most important thing that a student should consider when they're choosing to accept a spot?
Sure. So, making sure that you can do it financially is one of the big things. There is a differential tuition that goes along with the nursing program. So this is once you've gotten into the nursing program, there is a $79 differential fee per credit. That ends up being about $1,200, right around $1,200. Every semester of the nursing program is 15 credit hours. And so that differential is right around $1,200 on top of your tuition. So making sure that you're financially secure to go into the nursing program, because it's not really something that you can start and stop. So you're admitted as a cohort of 48 students. Those 48 students are in the same classes for 2 years together. And if, for instance, one student doesn't pass or has to stop out for different reasons, then that leaves a spot, right? And we want to graduate as many students as possible to make sure we get those nurses out there in the workforce that are so desperately needed. So making sure that you're financially ready, you're mentally ready, ready to go, and are committed for those 2 years of being 2 years, fall, spring, or spring, fall times 2, and no summers, which is nice. So you have your summers off. So you can work during the summer if you want. And after actually your first semester in the nursing program, you are eligible to sit for the LPN in NCLEX, and you can work as an LPN while you're going to school or that summer before you start your last year of the nursing program.
Oh, wow, that's super cool. I didn't know that was an option.
Yeah, it is. It's awesome.
Yeah. Oh. What should a student consider if they're interested in just starting this path? Like, what do they need to think about in making this commitment to this pathway for a career?
I think it's really important. I was a nurse for 30 plus years. I was a NICU nurse, so I worked with tiny babies. And I honestly did not know a lot about going into nursing when I went into nursing. I just know that I loved helping people and I really enjoyed science. So blending those two things together made me a good fit for nursing. Nursing is a very demanding career. If you work in a hospital, you are typically working 12-hour shifts, and that could be 12 hours in the evening or 2 hours all day long, or 12 hours all day long. So you're working from 6 a.m. to 6 p.m. many times not getting home until about 7 that night, or you're working just the opposite, 6 p.m. to 6 a.m., and many times not getting home until 7 a.m. in the morning. Okay. So making sure that that works well with you. I worked nights for 19 years. I just did it. It worked well for me and my kids. I was able to raise my kids without having to use childcare, but it worked well. But it was a commitment because you're working 3 12s, so you're working 36 hours a week, which is full time, whereas most workers who work 8-hour shifts work 40 hours. So there are perks. You do have to work weekends and holidays, all right, in many instances. So if you're working full time, typically you'll have to work 2 weekends a month. So that's either a Friday, Saturday, or Saturday, Sunday, depending. And then usually, depending again on the hospital, you have to work those holidays. And usually you have to work if you're working full time, 2 majors and 1 minor holiday. So 4th of July, that would be a major holiday, likely you'll be working, right? Especially as a new grad, right? There's a lot of hierarchy within nursing. So new grad or a new incoming nurse would have to work those shifts that they don't particularly want to. So take that into consideration too. There are lots and lots of different options within nursing. So you can work in a clinic, you can work like a 9 to 5 job, you can work at a school, you can work in a doctor's office, you can work in so many different things. That's the one great thing about nursing is there's so many different options and so many different avenues that you can consider. You know, a great place to start too is like doing an exploration class. We have a nursing exploration class called HLOC 2000, where I actually teach that class and I bring in nursing professionals and they talk about their educational journey, and then they talk about what they do at work as like a family nurse practitioner, an oncology nurse, a pediatric nurse, labor and delivery nurse, NICU nurse. We have just a vast array of nurses that come in and talk about their educational journey. And it always surprises me how different everybody's journey is. You know, there's not like a pigeonhole. This is the way, everybody does it. Your nursing journey is an individual journey for you. But going back to your question, I think finding your why am I doing this? Money is not enough because you have to give so much of yourself every day and sacrifice sometimes your own wants and needs for the betterment of your patient or to be the advocate for your patient. You have to be able to put your own needs aside. There was many nights where there was emergencies on our unit and it took me a long time before I could go to the bathroom or a long time before I could go to lunch. I can't, say peace out in the middle of a baby getting admitted and say, I'm going to lunch. You guys take care of this baby. It's an emergent situation. You have to put your own self. And if you're not willing to do that, nursing may not be the best place for you. So
that's
lots
cool.
Yeah, lots of different, but there are lots of different personalities in nursing. Like if you're an OR nurse, sometimes OR nurses are not the most personable, but most of the time their patient's knocked out anyway. So they don't have to be, right? So there's different niches for every nursing. Like you can find your passion wherever you're going.
That's awesome. When do students find out if they are accepted into the program?
So applications, again, are due, and there is a timeline. Let me go to this. There is a timeline here. So this tells you right when applications are due, the 3rd Monday of April and the 4th Monday of September. And then if you scroll down to these admission timelines, if you're applying we'll go to spring 2026 because that would be the next admission time that's due. So spring 26, you're applying and your application is due September 22nd. You'll find out a month later, a little bit less than a month later, by October 13th, if you got admitted to the program or not. And then you have 1 week to decide whether you're going to accept admission. So we do have a standby list, or we admit those 48 students, and then we have an alternate list, and we'll take students in the order that they're on the alternate list, and offer them the position if somebody of those 48 don't take the spot.
How many alternates do you typically have?
It varies. It's a discussion that we have as an admissions committee, based on our knowledge of the students that have applied. We may have some that are finishing up prereqs, and we may know that there may be some struggles getting prereqs finished, or we have some that are coming from different schools and maybe don't have everything they need, and we're kind of don't know if they'll have it by the time they apply. So we kind of take those things into consideration, and it depends on every application cycle.
Gotcha. What do students usually do if they're not accepted into the program?
That's another great question. So obviously you're going to meet with your advisor, and then there's different pathways. So I always tell my students, make sure that you give yourself 2 application cycles to apply. If you don't get in within 2 application cycles, then let's talk about backup plans or plan B. And plan B can be LPN program at Dixie Tech. If you apply to our program, then you have everything that you need to apply to the LPN program at Dixie Tech. You do a 10-month LPN program at Dixie Tech. Once you complete that, you can sit for the LPN boards, and then you can come back to us and do the LPN to RN program. And that, when you're finished with that, that gives you an associate of applied science in nursing. It's different than the bachelor's program, where the bachelor's program, you do two years of prerequisites, 2 years of your nursing classes, and you get a bachelor's of nursing. In this program, you have your LPN, you get your associates in nursing. You can still write RN after your name after you take the NCLEX, but you just have an associate, and then you can go on and get your bachelor's, which is usually 37-ish credits. So that usually could be done in about 3 semesters full-time, or 6 semesters part-time.
Gotcha. When a student applies, you have the course prereqs. Are there any other requirements that they need to make sure? I remember something about clinical experience or volunteering. I remember you saying something about that, but I don't remember the details.
No worries. So they do need to be a CNA. Depending on when you apply, when that CNA has to be completed. So if you're applying in the fall for the spring, you need to have your CNA before fall semester starts, okay? Because it'll be due by November 30th, before the spring semester. You also need to have your CPR, your BLS, basic life support for health professionals. That needs to be completed as well. And then all of your immunizations need to be completed. And that's really it to be able to apply. But there are application requirements that we consider when looking at nursing admissions. So the first thing, it's all numbers based. So we can take everybody's name off of it and just look at numbers. The first thing that it's a points value. So everything has points. The first thing that gets points is your GPA. And as I said, a GPA of a 3.0 gets the least amount of points, and the GPA of a 4.0 gets the most amount of points for that area. Okay. The other thing that we look at is what's called suggested electives. Here's a link for suggested electives. You can take up to 10 suggested electives to have them count on your nursing application. There is a lot of suggested electives here. Some of these suggested electives are 1 credit. They range all the way up to 4 credits. So if you took 10 1 credit suggested electives, you'd have maximum points in this area. The only caveat is they have to be completed with a C or better to count. So if you complete it with a C minus, then we don't use it. Okay, so unfortunate, but that's just the way it goes. Most incoming freshmen will have at least Trailblazer Connections as a good starting point for moving forward. Okay, so most students have at least 5. Sometimes if they're very diligent, we can get them up to 10. And that's where I talked about maxing out on your suggested electives. Okay, and it tells you right here, courses with C- are not accepted. Okay. The next thing that we look at for admissions that gets points is we look at holistic admissions. And what that means is looking at the whole person. And that's what nursing does. It looks at the whole person. So this is life experiences. We know that everybody doesn't come in on the same playground, right? Like there's different levels. And so we look at life experiences. So if you're on SNAP, WIC, or Pell Grants, there's points for that. If you're a military veteran, you also get points for that. Work experience. If you're working, you get points, but if you're working in the medical field doing patient care, like CNA, medical assistant, veterinary tech, dental assistant, maybe a patient transporter at the hospital, you get points, more points than if you were working at SWIG or just doing customer service. Okay. And then we also look at volunteer. So volunteer experience is, and it can be in anything. It does not have to be in healthcare, and it has to be within 3 years of application into the program. So if you're an incoming freshman, you can go back to your senior year, and if you were, on student council or, involved in activities, service activities, you can go back and get whoever was your direct volunteer supervisor, sign this form, and you can use this form. 100 hours is full points for this area, okay? But any points is going to help you. So every other, like if you had 50, you'd get half the points for this. Okay, 25, you get a quarter of the points, and so on. Does that make sense?
Yeah, that's helpful.
Awesome. So then the last thing that gets points for this area is things that are out of your control. So if you're a first generation college student, meaning neither of your parents completed a bachelor's degree, you're considered first gen. You get points for that. If you speak another language, there's points for that as well. Okay. So these 4 areas all together, if you were to add up the points in these, maximum points would be about the same as a 4.0 GPA. Okay, points that you get for a 4.0 GPA. So these are small things, but they add up. And remember when I talked about the student that had a 3.0, she was a CNA for more than 2 years. She had 100 hours of volunteer, and then she had a few of these other things, but not everything. So she maxed out these 2 areas that she had control over, the work experience and the volunteer experience, and her suggested electives. She was at 10. Okay. So super important if your grades, because just because you have straight A's doesn't make you a good nurse. It's not going to make you a good nurse. You need to have communication skills. You need to have other things that are going to be needed in healthcare, and that is being open-minded, being able to take criticism, things like that. So the last thing that we look at for the nursing application is this HESI. And so this is where I talked about the 4.0 student. You have to be able to retain the information. You can have all A's and you take the class, you take the test, and it all goes out the window. You learned everything, but it all goes out the window. This makes sure that you retain the information, or you're retaining the information, so we don't have to reteach you anatomy, physiology, all of those things. We can't go back and reteach you those things once you're in the nursing program. You need to bring that with you. This is what the HESI tests you on. So it's English language, and it's going to be scientific reading comprehension, vocab, general knowledge, grammar, basic math skills, and then your sciences. Chemistry, 25 points, anatomy and physiology together, 25 questions or points, and then biology, 25 questions. This is a test that's open year-round. You take it at the Utah Tech Professional Testing Center. You get 5 hours to take the test. The cost is $70. You want to make sure that you plan to take this test a minimum of 2 times. Unless you scored a 95 or above on your first attempt, you want to take it a second time, because you will have access to what's called test remediation. Test remediation will give you a personalized study guide based on how you did on the test the first time. which is very, very informative and good for students. There's also a HESI prep book that you can use to help you test. In this book, it has it has test questions, and then it also has a code where you can go in and get other tests. Okay, so this book and the testing remediation go together. The people that designed the test are the people who wrote this book too. So it's dedicated to the book.
When, oh,
Go
sorry.
ahead. No,
Go
go
ahead.
ahead. So any section that you score below 70 points on would disqualify your nursing application. And you honestly want to have your score needs to be above 75 for any points. Between 74 points and 70, you don't get any points for that section. Each section is scored independently. So like math is scored independently, English reading comprehension scored independently. So every section you need to be 70 is minimum, but you really need to be much higher to be competitive.
Okay. When do you recommend students take this for the first time in the sequence of the, like, is it after they're taking physiology? Is it in, or is it like, do you have a recommendation about when?
So here's like a recommended sample schedule for nursing. Typically, I tell students you want to take it between these two semesters, between your third and fourth semester, or in your fourth semester. You want to have completed bio, anatomy, phys, and chemistry.
Okay.
Probably most important is completing bio, anatomy, or phys, and chemistry, because anatomy and phys are together, and every anatomy or physiology class, you're going to get a little bit of anatomy or physiology, depending on what class you're taking. So usually students can still do well in anatomy and physiology and be in one of those and still take the test. I don't recommend that, but it does work for students who are trying to move through. But typically we wait until this fourth semester to take it after you've completed anatomy, phys, chem, and bio.
Gotcha. Okay, so when you start the nursing program, when does it begin? You get in, yay! And when does it begin?
So it follows the same calendar as the college. So you'll start January or August, just depending on what semester you're starting in. There is the week before school starts, there is typically an orientation day that is a mandatory orientation day that if you're not there, they'll drop you from the program.
Oh, wow. So
Yeah.
Gotta be serious.
And you know that as soon as you get into the program, you know what day that's going to be.
Awesome. Once students are in the nursing program, it's 2 full years, correct?
Mm-hmm.
And can they take other classes, or is it straight on nursing classes once they're in?
They really frown on taking other classes because you're at 15 credits and it is rigorous. They really would prefer you not to take other classes. The other problem is you'll be doing clinicals, and the clinicals can be either during the day or they can be in the evening. So you don't really know what your schedule is until that semester when you start.
Oh. And then is it possible to work while you're in the nursing program, or is it too rigorous to have a job at the same time?
So with the pre-licensure BSN program, the nursing department discourages students from working. However, if you talk to other students, there's some students that do work. They'll work weekends or work in the evenings when they're not in school. But it's very difficult to hold down a full-time position. The great thing with healthcare is you can work what's called per diem. And there are going to be some downtimes, like you can pick up shifts when maybe you don't have a test that week or something like that. So you can pick up shifts as a CNA, things like that. So some people do work a little bit, but I definitely think full-time is not something that you should consider. And that's why we talked about the financial implications, making sure you're ready to go. It's better if you don't work, but we realize that you do need to work, but they're not going to make accommodations for you working
Okay.
at all.
Do students that are in the nursing program get clinical experience in our area in St. George?
Yeah, they do. So most of the clinicals are done at St. George Regional Center, and then there are some done first semester at some of the different facilities in the area, like rehab facilities, but that would only be for one semester. But they really try to place you in the hospital going forward. And then your last semester, you do community health nursing, which you go out with another nurse that already has her license, and you go and do visits, in-home visits or in-home facility visits that provide nursing care. Yeah.
Okay. How much does a nurse make?
So starting nurses can typically make, it depends on how much overtime you work, but I've heard at St. George Regional that they're making about 30, starting out about $30 an hour. There's also what's weekend differential. Some can be anywhere from $3 to $5 an hour. And then night differential also can range from $3 to $7 an hour. It just depends. So you could be making upwards of like $40 an hour as a beginning nurse, depending on differentials and those kinds of things.
Wow, that's a very good wage.
It is very good.
And I think you already hit on this about the work hours that they're usually, I mean, it depends on your setting, but in the hospital you have 12-hour shifts and they can be in the morning or the night.
Yeah.
Is there anything you would add about the typical work hours a nurse might have? Weekends,
No,
holidays?
yeah, definitely weekends and holidays. But of course, I mean, it really depends on you. You can work around that, but I would say that most nurses have to do some time in the hospital. But not all nurses. Like it really depends on you and what you want to do with your nursing degree. But I don't see too many nurses that are able to work around not doing nights and weekends and holidays.
Especially at the beginning, right?
Yeah, you're low man on the totem pole.
Right? That's just how it
Mhm.
is. Dang it.
It is. It's life.
Are there other professions that nurses could pursue if they decided to move away from nursing after doing it for a while?
Yeah, like me.
Yeah, that's true.
So yes, absolutely. Nurses are the one of the most trusted professions in the nation, and so you can do a lot of different things. I've been an entrepreneur, and so I had my own business when I lived in California. I had my own business where I went to people's houses and taught them infant CPR and baby care basics. You can do so many different things. I mean, it's really a profession that lends itself. You could be like a health coach. You could be work for an insurance company and call families that need help, like getting benefits or things like that, and help explain like health conditions. There's so many different avenues with nursing, and you can create an avenue for yourself like I did when I was an entrepreneur. I created that. Nobody had done that before, but I saw a need where I was living and said, "Oh, I could fulfill a need with this because of the expertise that I had working in the NICU and working with families who were, had a baby that came home from the NICU." So what I did also was I went into their home and I helped them transition from coming home from the NICU to feeling confident coming home on their own, right? So I stayed with them like the first couple weeks and just help them transition that baby home and let them feel comfortable, getting them up and running, making sure they
Right.
had all their meds and their doctor's appointments and that kind of thing. So in my area there was a need. Here, there wouldn't be as much of a need. So I think a lot of people with nursing can find different expertise. There's lawyers, people that go in and testify, uh, and the name has professional testimony, but I can't think of the name of it. Expert witnesses.
Mm.
They're expert witnesses for different like clinical concerns, you
Hmm.
know. And it really depends on what you want to do. You can make nursing anything you want to, and that's the great thing. And then you can also pivot. You can move every 5 years, or you can move into a new profession. There's also travel nursing. If you're a traveler at heart and you want to go to a different state or you want to even go to a different country, You can take your nursing with you if you want to go like on mercy ships that provide support for families that have that are in different countries that don't have good medical care. Mercy Ships comes in and does like cleft palate surgeries, eye surgeries, things like that. And you're working with doctors and other nurses, respiratory therapists, providing support for families that way.
Wow, so many options. That's exciting.
There are, yeah, yeah.
Last question, Gina, and thank you so much for your time, is just, is there any piece of advice you would share with an incoming prospective nursing student on what they need to be thinking about as they start down this path?
So two things, if you'll allow me. One, meet with an advisor. Meet with a nursing advisor so that we can help you kind of navigate. And Jamie will tell you this too, like you guys, SSP will send us students just so we can talk to them about the nursing pathway. I'm a nurse. I'm happy to talk to you about it. Research, talk to people that are nurses. Don't go in blind because it is such a rigorous profession, a demanding profession. You really can't say, oh, I saw, a nurse on TV and this is what I think they do, because it's a little bit different. All right. And then I think the other thing is you have to be dedicated to school. You have to be dedicated. You can't be half. It can't be half. You can't be trying to work full time and trying to go to school full time. Make a decision. If I'm going to work full time, then I'm going to go to school part time. If I'm going to go to school full time, I can work part time. You just need to find the balance so that you can do well in your classes, and slow and steady is way better than trying to force something, right? And then lastly, there's always options. Even if you can't, we can't get you into this nursing program, there's options, and come and talk to us and we can give you what options there are, because healthcare is such a demanding profession. There's so many opportunities. Maybe nursing isn't your exact niche. We can find another niche that will help and suit you personality wise, and then maybe schedule wise. So just ask. Yeah.
Lovely. Well, I
Yeah.
appreciate your time. I think this interview is going to be super helpful for a lot of our students who really want to go into this profession and need to know how to get in and what it's like and what they need to consider, whether it's a good path for them. So I appreciate you.
Yeah, you're so welcome. I'm excited for all your students coming to nursing.
Thank you, Gina.
Okay. All right. Take care, Jamie.
Bye.
Bye.